Peer support for me means that my fear can go away.
People who have serious mental illness have about 2 to 3 times the rate of diabetes. It depends on the kind of mental illness, because there are obviously many kinds. And the more serious kinds of mental illness like schizophrenia and bipolar disorder are where the rates are the highest.
I've worked in mental health for almost 20 years, and what I've seen is individuals with mental illness suffer with horrific, physical health problems that have not been addressed for years and years.
Well, the consequence of undertreatment and underdiagnosis can be severe illness and death. I know lots of people who became severely ill, and I've known some people who have died very young, 50. I know 2 people who died at 50.
There are such high rates of diabetes in people living with mental health problems and illnesses, and it's a population that a lot of physicians, nurses, and dietitians don't really know.
I've at times had clients complaining they would go in for treatment for an earache and be accused, are you hearing voices?
I was the one who asked to have my blood sugar checked and emerge, because I knew there might be something else. They never checked that, the blood sugar, right? And then they came back and went, you know what, your blood sugar's high. Oh, okay.
For me, it was the thirst. I was picking up on the symptoms of diabetes, and so I also asked my doctor to test me.
They found out that I was a diabetic. And I probably had symptoms for 5 years or more. I didn't realize it.
When someone has a mental illness, they go through a lot of grieving and loss in terms of that sense of who they are. And then to have that overlayered with diabetes, a lot of those same processes occur.
It is one more thing, but it's one more big thing. And just to have somebody tell you, now you have to go and eat this way, and now you have to exercise, and now you have to do this. It's a real change to a person's life.
Right now there's a gaping chasm between where people live and where professionalized services are being delivered. And if this new group of people can help bridge that gap, magic. That's what we need.
Peer support has been found to be helpful in a wide variety of chronic diseases, particularly chronic diseases, because the experience of the person who's had the disease, who's had the treatment, who's had the complications, who's taken the medications, who's had the side effects of taking the medications, is a perspective that most of the treaters don't bring.
A lot of my previous research has been around peer support. It's one of the reasons I was asked to participate in this study, and we have found that peer support is very helpful in actually reducing reliance on hospitalization and keeping people in the community.
Peer supporters are uniquely positioned to help people learn the risks, to help people self-manage, and to help people do prevention, simply because peer supporters that are connected to consumer survivor initiatives are trusted.
The mental health peer support sector is a gold mine that needs to be tapped into more.
They know what the pain, what the journey is, and they can help support the person.
The issue that I think we in the healthcare system worry about when you start talking about non-professional models of care delivery is that people understand the boundaries.
But as they've come to understand that we're not asking peer supporters to be diabetes experts, but that they have other skills that can complement the skills and knowledge of the health professionals, they've really started to get excited about the idea that peer support can help them to do their jobs better.
And I've been a part of the training, so I know how the training happens. There's a very clear demarcation between what it is to be a diabetes peer supporter and what professionalized services do.
So it's not that we're turning the peer supporters into diabetes specialists, but that they're diabetes aware and that they can refer on to the specialists.
One is not a substitute for the other. They work together.
We can share with the diabetes community the experience and what that's like. They can share with us some of the knowledge.
Knowing we're not alone, I think it's one of the biggest gifts, and it takes us out of that isolation.
Could I be a cheerleader and say, look, I mean, you can do this. You can get information, this will help you, your life will be better by doing so.